Hello, my name is Justin Allen. I'm a postdoctoral fellow from Boston Children's Hospital, Department of Orthopedics, and Harvard Medical School Department of Genetics. Today, along with my colleagues Katerina Storosenko, Igor Kalin, and Suchitra Esrawan, we will be presenting a life cycle strategic plan for Zometa, which is an injection of zoledronic acid. So to outline our talk, I will be presenting a general overview and describing the market, and also the regulatory strategy for Zometa. Katerina will present the preclinical studies and the sales strategy and managed markets. Igor will present both the early and late clinical development, and Suchitra will present the intellectual property and marketing strategies. So what is Zometa? Zometa is an injectable bisphosphonate. Bisphosphonates are a class of molecules that inhibit the action of osteoclasts in bone breakdown or catabolism. So this results in an inhibition of the release of calcium from bones, but also can increase both the density of bones and their strength. Just for some broad definitions, Zometa has approval for the treatment of hypercalcemia of malignancy, also known as tumor-induced hypercalcemia, which refers to high circulating levels of calcium caused by cancer. Zometa is also used in the treatment of multiple myeloma, a cancer of white blood cells in the bone marrow, and also in bone metastases, a cancer that has spread to the bone from solid tumours elsewhere in the body. It is important to note that Zometa is not used as an anti-cancer therapy. Rather, Zometa can reduce the risk of skeletal-related events in cancers with bone metastases. So this broad term refers to pathological fractures, spinal cord compression, radiation or surgery to bone, or, as I mentioned, tumor-induced hypercalcemia. So to look at the disease burden and market opportunity for Zometa, worldwide, breast cancer accounts for nearly a quarter of all cancers in women. And these figures are a few years old, but worldwide, breast cancer causes almost 500,000 deaths. Prostate cancer is the second leading cause of cancer-related death in men in the US. And importantly, just looking at these two types of cancer, 65 to 75% of breast cancer patients and prostate cancer patients develop metastases to bone. And although multiple myeloma is considerably more rare than these cancers, almost all patients with multiple myeloma have bone lesions at time of their diagnosis. So then to look at the numbers, bone metastases are found at autopsy in approximately 350,000 cancer patients in the US alone. And this figure is likely to be twice or three times this number if the European Union and Japan are also to be included. And importantly, as treatments for these cancers result in increased survival, this also means that the incidence of skeletal complications are also increasing. And this can significantly impact the survival rate of cancer patients. So the market for bisphosphonates in general is over $1.5 billion per year in the US alone. So how does Zometa compare to other bisphosphonates? Permethrinate was the previous standard of care for bone metastasis and multiple myeloma treatments. Zometa has been shown to be 2 to 3 orders of magnitude more potent than permethrinate. So just to look at the dosing, Zometa is given as an infusion of 4 milligrams over 15 minutes. And compare this to permethrinate, which is dosed at 90 milligrams over 2 hours. So Zometa treatment results in a much better quality of life for these patients, and it has also been shown to have increased efficacy as well as cost effectiveness. And these are to be discussed in later slides by my colleagues. And to look at the indications that Zometa has been approved for across the EU as well as in the US, Zometa has been approved for a broader range of cancers compared to other bisphosphonates. It has been approved for in over 95 countries now, and more than 4 million patients have been treated worldwide with Zometa. And my colleagues will now discuss the development of Zometa in more detail.